I obviously went to med school. I went to med school at the Uniformed Services University, so I was an engineer in the Air Force before I went to med school. And so then I did 3 years as an engineer, and then I went to med school at the Uniformed Services University. Then I did an internship in internal medicine, and then went and practiced as a flight surgeon for 2 years, doing flight medicine at a missile base, actually. So taking care of missileers and bomber pilots. Then I went back and I finished my internal medicine residency. So I did a full 3 years of internal medicine training, got board certified in that, and then I went to Korea for 2 years as the only internist on the peninsula for the Air Force. Then I went back and I did a residency in aerospace medicine, which consisted of getting a master's in public health from Johns Hopkins, and then 1 year of aerospace medicine training and 1 year of preventive medicine training. So I got board certified in aerospace and preventive medicine. I'm the 87th Aerospace Medicine Squadron Commander and Chief of Aerospace Medicine. As the commander, I supervise between 80 and 90 people, a mishmash of civilians and active duty, and then some civilian contractors as well. It's all this stuff that goes along with supervising employees, leadership, as well as some program management. And then Chief of Aerospace Medicine means I'm responsible for lots of programs, mostly having to do with the operational mission of the Air Force. So I don't get as involved in the day-to-day details of the medical stuff that we do, but more so the way the medical mission that we take on interacts with the operational mission of the Air Force. So, for example, I'm responsible for profiles, duty limiting profiles, profiles that limit people from deploying because of medical conditions. I'm responsible for all the physicals for people who are going into flying careers, ensuring that they're done properly. Processing waivers for people who have medical conditions that would limit their ability to do flying jobs is another big part of my job. I also am responsible for all kinds of medical readiness stuff. So there are certain things that in the Air Force we're required to do as an active duty member in order to be medically cleared to deploy, and I'm kind of responsible for all that stuff. We have all the deployment medicine that falls under me, so clearing people for deployment, doing post-deployment evaluations for injuries, PTSD, all of those concerns, that all falls under me. Public health falls under me as the Chief of Aerospace Medicine, so we do all the same stuff that any basically health department would be responsible for, as far as doing inspections of all the food facilities on the base. We do inspections of all the daycares, the barbershops. We're responsible for if people get tick bites, testing the ticks for Lyme disease. We do all the STD investigations for anybody who gets a positive that's on the joint base. We manage the latent TB program, so anybody who has latent tuberculosis, we're going to manage their treatment of their latent TB, 9 months of INH, with monthly visits with a provider. We also have bioenvironmental engineering, which basically involves a huge amount of stuff that you don't normally do as a doctor, but they fall under the SGP programmatically, and so they do all the industrial hygiene. So OSHA mandates, people who are exposed to certain hazards, chemicals, etc. We're responsible for going out to the workplace and determining what the hazards are, and then providing a plan for the workplace to mitigate that hazard, whether it be if they're exposed to a chemical, maybe we can substitute a different chemical, or, figuring out ways to decrease the amount of exposure that people have, or, personal protective equipment in order to do that. So they're responsible for that. They're also responsible for implementing the Nuclear Regulatory Commission, regulations for radiation safety for all radiation sources on the base, laser safety for all lasers on the base. We've got somewhere over 500 regulated lasers on the base that our bioenvironmental shop is responsible for. Respiratory fit testing for all workers who are required to wear respirators at work for the entire joint base. You know, and when you think about all the aircraft maintenance shops and you know, all the back shops for the people on the flight line, it ends up being a big responsibility for all that industrial hygiene and workplace safety stuff. So I wanted a job where I could use my education for the rest of my career. And even now, as I'm doing all this administrative work, I'm still very much using my medical and my public health and my preventive medicine and my aerospace medicine and even my internal medicine education when I'm reviewing all of our aircrew members who are down for medical reasons, and we're talking about what we're doing to take care of them. That internal medicine background is actually still really important. And so this is, you know, one of the few careers where they want me for my training, even as a more senior officer. I'm still using that technical training. I mean, on this base, for specifically in my job, my biggest challenge has been issues with joint basing in general. There have been a lot of challenges with how we implement joint basing and making it where we're providing the service to our Army and Navy counterparts that we absolutely should be providing to them. You know, I've grown up Air Force, and I know Air Force medicine, and I know the Air Force system, and sometimes the systems are different in the Army and the Navy side. And you know, it's a challenge providing the service that we need to be providing to some of the other services on the joint base. And